Infertility is very, very hard these days. Let's all consider coronavirus. People are locked down. Everybody in their different houses. How do you think people that are looking for children will be feeling right now? First month, second month, third month, still no pregnancy, sex every day. I don't think you can understand what I'm trying to paint. People are pressed, people are depressed, people are anxious, people are going through a lot, all in the name of looking for baby. It's a lot. So if you are house there, you are still a spinster, you are still a young person, you are still a single man or woman, there's a lot you can do to prevent this havoc from befalling you. It's a lot of stress from family, from friends, and everybody cares. Everybody, they are all trying to help you, but you are the one feeling the heat, you are the one feeling the pressure of infertility. People are going through hell in order to get babies. So as we are going to go through this episodes by episode, talking about what young people can do to prevent infertility in the future, I want you to follow me closely so that we can all have fun and enjoy the discussion. I'm going to be talking about 3 groups of people. The first person is, let's say, somebody, a virgin that is virgin when married, with no previous exposure to sex, infection, pregnancy. You understand what I'm saying? And the second group will be group of people that are also virgins but have no idea what their blood group is, what their genotype is, what they know nothing about pregnancy. Now the third group of people are people that are already exposed. They understand sex, they understand PID, they understand infection, they already have exposure to all these factors. So infertility is not something that spare anybody. People that are virgin, that are coming straight up from marriage, that are just encountering sex for the first time, do have infertility. Likewise, people that have had several episodes of vaginal infection, sexually transmitted infection, even people that have aborted before, they too can be a victim of infertility. So anybody can have this condition. It's not something that someone is holier than the other. No, it does not select. So let's go through reasons why people might have to watch out for infertility and what we can do to prevent it in the nearest future. So let's look at this scenario. I know you actually fall into one of these categories, so you pick your own as we go forward. Before we start talking about what you can do to prevent infertility, let's quickly look at the consequences, the complications, what people have to go through when they have this condition called infertility. Infertility is when throughout 1 year of adequate, consistent, unprotected sexual intercourse, throughout the whole year, the person still cannot achieve conception. That is, the person could not get pregnant, even though the sex was adequate, even though the husband was always around, even though the wife was always around. Both of them could not achieve conception, they could not get pregnant. That's infertility. We don't say there is infertility when the couple are not staying together, or their sex has not been regular throughout the week, or maybe both of them are still using family planning, or they are protecting, they are not on the same page. One wants to protect, one is not, still is interested in making babies. So infertility, before we can diagnose infertility, both couples have to have adequate, consistent, unprotected sexual intercourse for at least a year before you can now start running around and say you want to go through investigations, before you say you want to go through tests. Now, what are the consequences? It's very hard. Okay, assuming, let's talk about young couples now. You just got married and people are looking at you anytime you come to church or you go to mosque or in a gathering of friends. They are looking at you, they are looking at your tummy, they are looking at you, they are looking at your tummy, or they are asking your husband, how far now, guy, what's going on? It's because they care, but in your own mind, in your head, you are feeling the pressure. They are asking after 6 months, what's going on? 8 months, what's going on? 1 year, what's going on? You are the only one that can understand what is going on, but people around you, even if they don't want to ask, they will be feeling like you will think they don't care if they don't ask. So it's still the two way. People around you are feeling the heat, they are feeling the need to ask you the question, whereas you are feeling like they are pressurizing you because you could not get pregnant. So it's the two way. Your mother, your in-law, everybody, your brothers, your sisters, they want to know, why are you not pregnant? What can we do to help? How can we support you? Have you gone to the hospital? Have you gone to this? Have you done this? Have you done that? Does your husband know how to do sex? Do you understand what sex is? Are you guys doing it? You know, there are a lot of questions, lots of them that people will start asking you when they have been watching and they've been watching, and there's nothing protruding out of your tummy. So it's a lot of pressure. Everybody feels it. Everybody around you, they all get pressurized, not just you. Just understand that, not just you. So there's also this social stigma that even some people will start feeling guilty that maybe I'm not adequate, maybe I'm not complete, maybe I'm the one that is deficient. Why am I not pregnant? You know, it's easy for people to start feeling that way. It's not just women. Women could voice out their own depression, but men feel it too. They feel inadequate. They feel like, is it that my sperm is not strong good enough? Is it that I'm not very good with this sex? There are a lot of things that even men go through that they will not tell anybody. Everybody feels it. That's just the truth. They feel guilty, they feel inadequate, they feel incomplete. That I've been doing this thing, other people have been doing it, and they've been making babies. What's stopping me? Why am I not making babies? So there's a lot of questions to be answered. Now, there's always this part, anxiety. Every month, oh my God, immediately your menses is coming, you're already anxious. You want to know, am I pregnant? Am I not pregnant? I'm feeling this, I'm feeling that. Doctor is like this. Doctor, this is what I'm saying. Wait for your menstruation time to pass before you start thinking about running tests or doing any workup. Wait, relax. That's what we always tell them, but we also understand that it's not easy. That's just the truth. Now, the financial constraint. After that 1 year, a lot of tests to do, a lot of investigations. They are not cheap. Most of them are expensive, and this is another part of let's say another responsibility consuming the family income. Do you understand what I'm trying to paint? It's consuming both emotionally and financially. If it's a family that are not really financially buoyant, they might not be able to set apart a particular amount of money in order to run investigation that will point out what is wrong in their body, whether for the male or the female, in order to be able to help them achieve pregnancy. So it's cost intensive. So those are the reasons why, if you are still out there and you are still safe, you should come and learn what to do now to prevent infertility in the future, because it's a lot of pressure and you don't want to go through that, I believe. As a young woman or as a young man that is trying to prevent infertility in the future, marry as soon as possible. As much as you have the opportunity, the chance, the enablement, the financial capability to make marriage work, marry and have your children. Even as old as we are, that we have gone ahead, we still have all those fears that they will still put in our head, that as you grow older, the possibility of you producing an imbecile or a child that is not okay is getting higher. It's the same way the possibility of going infertile is also going higher, because they say as women age, the rate of the production of their eggs reduces. And also for men, it's the same thing. Sperm production, sperm content and all that, they also can reduce. That's just the truth, even though men still have age on their side. So as much as possible, either you are a man or a woman, get married when you think you are able, you can handle it, you are emotionally and financially ready to get married. Though I cannot specifically say that you will not have babies at a particular age, because it's God that gives children, but at the same time, medically, it's good to get married early. As much as possible, try and work hard so that you will not come and put somebody's child under distress in marriage. It's important that you are financially buoyant, because everything in marriage still depends on money. Don't say they've told me in church or in the mosque that should not worry, God will provide, God do this, God will do that. Make sure you also use your brain, because God has also given us the brain to bring something priceless out of something that is worthless. God has given you the brain to make money. So make money first though, before you carry the responsibility of the whole world on your shoulder as a young guy. Make money first. Don't come and put somebody's child and unborn baby in danger because you didn't plan well. So it is important to get married early. At the same time, it is important to make sure that you are financially, emotionally, and physically ready. Secondly, avoid unnecessary medications, unnecessary drugs, drinks, alcohol, smoking. They are all drugs. So avoid them as much as possible. If you don't drink alcohol, don't bother, don't drink it. If you don't smoke, don't try it. If you don't take caffeine and all these strong medications, don't try them, because a lot of them have effects on the sperm production capacity and also on the egg production capacity. They all can influence the and cause some damages or some manipulations to our sperms and our eggs. So let's try and avoid drugs, medications, alcohol, smoking as much as possible. These are the effects that they can have on our fertility. Let's avoid them. Ensure you have healthy weight and healthy diet. It is very important. Some people are so skinny that you wonder if there's any hormone in their body. So skinny. They will still say their diet, is a lie, is poverty. Anyway, some people just want to have a very slim stature. There's no sin in that, but you need some level of fat to be able to produce good eggs, to be able to menstruate, for your hormone system to work. As a young girl, you need some level of fat to be able to allow your hormonal system to function normally. So don't go very skinny. Maintain a particular healthy weight. It is very important. And also, don't say because we have said you should have some level of fat and now go and be overweight. Overweight also is not good for pregnancy. A lot of people have to pass through a lot of tests and investigations because they already overweight. They cannot make babies. They could not produce egg. They have the condition that we call polycystic ovarian syndrome. When you are overweight, you can also have a lot of conditions that might put you at risk of infertility. So it's both way. Don't be too skinny. At the same time, don't be overweight. Maintain a healthy weight and also a healthy diet. Try and eat well. A lot of you out there, when you are still single, you take garri in the morning, garri in the afternoon, garri in the night because you are too lazy to cook. I understand. Too much activities, sister here, mother there, you want to satisfy everybody. Please, at the same time, take good care of yourself. Take good care of yourself as you are taking good care of people in the vineyard, in the church, in the mosque. You are caring for everybody. Don't leave yourself out of it. Make sure you eat healthy diet. It's very important so that you will not fall victim of infertility in the nearest future. There are some brides that you'll be wondering, this person is getting married. Are you kidding me? See how small this person is. No, eat well, look good, look well, so that at the long run you have some chance of having good eggs in order to make beautiful babies. I believe you are going to make beautiful babies. Yeah. If it is possible for you to abstain from sex now, please do it. But if it is not possible, because these days everything has been mixed up, even though we always say the standard of the Lord is still sure that we should always be obedient. If you can abstain from sex, my sister, abstain. But if it is not possible for you to abstain from sex, ensure that you protect yourself. Don't do unprotected sex. Do protected sex, please. Make sure you protect yourself, because a lot of people actually drag themselves into this issue because they've gone through a lot of sexual exposure, PID, infection, abortion, and all sorts before they even got married. So if you can protect yourself, try and protect yourself. Infection can make you have infertility in the future. Ask me how. When you have infection, women don't most of the time show signs of infection when they have sexually transmitted infection, because the pathway to the womb is long. You still have to pass through the vagina to the cervix to the uterus, so they might not even have any pain until it is very heavy, and at that level it might have affected your uterus, affected your fallopian tube, affected your ovaries. We call it pelvic inflammatory diseases, PID. That's why a lot of people after marriage will be having issues with fertility. Also, if you had exposure to abortion before, a lot of people don't want to go to the hospital for evacuation, so they take medications for abortion. And when you take medications for abortion, it might remain there. Some membranes might still remain in the womb. So when the membranes are still there, it can heal up and make your uterus to stick together. We call it uterine syncytial. So in the future, the person will be expecting to get pregnant, whereas the uterus is not potent. There is no space within the uterus again. It's already gummed together. So in that case, the person can be infertile for a long time looking for the cause, and obviously the cause is there. So another thing that can occur when you actually are exposed to infection, sexually transmitted infection, abortion and all that, is endometritis, where the lining of your womb will be having infection. You will be menstruating, but it will be painful because you already introduced microorganism into your body. So there are a lot of consequences that actually follow exposure to early exposure to sex, because it's not needed. Early exposure to sex, it causes a lot of headache in the future. Avoid it if it is possible, as a man, as a woman, because it's not just the woman that is going through the headache in the family. The husband is also vomiting the money for the woman to take to the hospital. So it's both way. Protect yourself, protect your spouse, and protect your future in the protect your nearest future. That's the way it works. So if it is possible for you to avoid sex, avoid it. But if it is not possible for you to avoid sex totally, make sure that you protect yourself. Avoid sex.